The way in which records are arranged is referred to as a filing system. The primary purpose of a filing system is to facilitate the storage and retrieval of records. The secondary function of a filing system is to allow for expansion of the records with a minimal amount of interruption. There are two systems used to arrange medical records: an alphabetic system and a numeric system. This procedure demonstrates how to file patient records using the numeric system. In many medical offices, each new patient is assigned a number. The patient's number can be accessed with other data in the computer, although the patient may also be given a plastic card with the medical identification number on it. There are two major advantages to a numeric filing system. It is easier to preserve patient confidentiality, and, in large medical offices, it is easier to identify a patient by number when several patients have the same last name. The main disadvantage of using a numeric system for medical records management is that it is an indirect system. This means the computer must be consulted to link the patient's name with the record identification number. The most common numeric filing system used in medical offices uses a 6-digit number with a hyphen between each group of 2 digits. This filing system is called terminal digit filing, which means it uses the final group of digits as the first filing unit. With terminal digit filing, the numbers are indexed by group, working back from the final to the first group. Within each group, the numbers are arranged from lowest to highest. In the files, all records whose number ends in 19 are filed together after records that end in 18 and before records that end in 20. Files whose middle 2 numbers are 22 are filed after files whose middle 2 numbers are 21 and before files whose middle 2 numbers are 23. Files with the same last 4 numbers are arranged in numeric order by the first 2 numbers. To file the record with the numbers 01, 22, 19, the medical assistant would first locate the position of charts that end in 19, the first filing unit. Assuming that there would be several records that end in 19, the medical assistant would then locate the charts that end in 22, 19. Finally, the medical assistant would file the record between 00, 22, 19 and 02, 22, 19. Be aware that a terminal digit filing system mixes up active and inactive records in the files, so the numbers of the newest and usually most active patients are not all located in the same section of the shelves. Though it's not as common in medical offices, another system is the consecutive filing system. In this system, numbers are arranged and filed from the lowest to the highest. Zeros are assigned or assumed as the first unit, so that each number has the same number of digits. To file the record using the numeric filing system, gather the records that are ready to be filed. Remove any elastic bands or paper clips. These prevent the record from sliding easily in and out of the file. Check the records to be sure that no loose sheets of paper are present. If loose sheets are found, insert them in the record. Sort the records according to the terminal digit indexing units using the sorter if available. Find the correct location in the file for the first record based on the final group of numbers. Refine your search based on the middle group of numbers and then the first group of numbers. Find the correct location for the record. Pull the out guide halfway out. Slide the record in front of the out guide and finish removing the out guide. If your office does not use out guides, use your hand to make a space between the record before and the record after the one you are filing. If there is an index card in the out guide showing who had the record from the out guide, remove it. Place the out guide with other unused out guides. Some offices keep index cards for the physicians in separate boxes so that new cards do not need to be written. Some offices cross out the name and reuse the index cards. And some offices use slips of paper that are discarded after each use. File each record in the same way until all records have been filed.